Thank you. Thank you so much. I'm really happy to be here talking about adverse effects. And at this conference, you're going to hear a lot about the positive effects of psychedelics, and that's very much deserved. But for the next 40 minutes or so, I hope you'll let me take you on a little journey to the other side. And actually, I'm going to try and end things on a hopeful note, believe it or not. So one thing I really like about these conferences every year is that because it's an annual conference, it's a great chance to reflect on things that have changed in this field in the past year or two. And with adverse effects, I think a lot really has changed. Here's just a few examples of some of the research institutions and publications that have focused on the adverse effects or the negative side of psychedelics in the past couple of years. Many of them have been leading institutions, and many of them have really revved up this kind of research in the past couple of years. There's really a hunger for it that I've started to feel. And I think part of that is this field becoming a little more mature as it grows. A little while ago, as the hype around psychedelics started to really get going, people were kind of thinking, you know what, we've had this war on drugs for 10, 20, 30 years. We've spent a lot of time focused on the negative effects. You might recognize some of this type of propaganda. You know, if you take LSD, you're going to think you can fly and jump out of a window, that sort of thing. We've spent enough time on the adverse effects and on the negative stuff, and now it's time to compensate for that and talk about the positives, because we've spent enough time on the negative stuff. Except I think people are starting to realize we actually haven't, because this isn't the negative stuff. This is misleading, fake news. Some of it's just outright wrong. So where's the real information on adverse effects from psychedelics? I hope that I can give you at least an overview of it today. I'm going to start by hopefully convincing you that we should study adverse effects. And then I'm going to introduce some of our research in Fribourg, right here in Switzerland, in the lab of Gregor Hasler, where we focus on this. We also study some of the good stuff, but adverse effects are one area of expertise for us. And then I'm going to take you on a journey through some of the most troublesome types of adverse effects that can occur after psychedelics. And I hope I can also give you an idea of how complex this topic is, because adverse effects means a lot of things. So if you're not already convinced that we should study adverse effects, I'm going to try my best to convince you now. First, the definition. An adverse effect is an unwanted, harmful effect arising from an intervention, in this case, psychedelics. Unwanted and harmful. As we just heard in the last talk, oftentimes, especially when psychedelics are used in therapy, the process can be painful. It's not fun, but it's not ultimately unwanted or harmful. So when we talk about adverse effects, I'm really talking about the stuff that you really don't want to happen. And some adverse effects are mild, like people get headaches from psychedelics a lot, but it's not really a big deal. But in clinical trials, we also talk about serious adverse effects, and that's anything that leads to potentially death, hospitalization, birth defects, or disability, or requires intervention in order to stop one of those things from happening. And the reason we study adverse effects with psychedelics is essentially because people experience them. There was a study back in 2016 that was, I believe, done by Johns Hopkins, where they interviewed people who'd had challenging experiences with psilocybin mushrooms. And they found that 10% of those people felt that they had psychological difficulties lasting for over 1 year after that experience. About 7% of them even sought professional help for dealing with those difficulties. And 16% of them said that they did not ultimately benefit from the experience. So these weren't necessarily just people going through some difficult processing. It was actually an adverse effect. And I hope that number, 16%, already gives you a little idea of how complex this topic is, because 16% said they didn't benefit. That leaves 84% who said they did. So sometimes people go through some psychological troubles after a trip and they ultimately feel that they benefited from it. This is quite common, actually. And sometimes people don't feel like that at all. Sometimes it really is just a bad trip that had bad after effects, and if people could go back in time and undo it, they would. And the point of studying adverse effects really is to bring that number down, this 16% of people who felt that they had psychological difficulties after a trip that they did not benefit from. It's also good for researchers. I'm a researcher, and I run a study with LSD. And we have an informed consent procedure where we tell people what to expect from LSD, and we want to be able to give them good information. So studying adverse effects improves informed consent procedures for healthy participants and also for patients. And of course, it's also good harm reduction for people who use psychedelics. We want our research on adverse effects to be published for pretty much anybody to be able to read. It's good for everybody to know. And so that's the point. It's not about prohibition. It's about understanding everything that psychedelic drugs are capable of and reducing the needless suffering that can sometimes result from certain types of experiences. So let me now introduce you to our studies in Fribourg. I work in the lab of Professor Gregor Hasler, and I'm going to bring data on adverse effects from 3 different studies today that we do in Fribourg. The first one is a study of LSD in healthy volunteers. They get 100 micrograms of LSD, and then we measure their brain activity, and we're looking for evidence of neuroplasticity. But we also do an assessment of adverse effects. I also have data, which was very kindly given to me by my boss, Gregor Hasler, from his patients. As many of you hopefully know, in Switzerland, psychedelic therapy is possible in a legal manner for people who have treatment-resistant conditions. Dr. Hasler does some of these treatments, and he also systematically assesses adverse effects after these treatments. And lastly, we are currently running an online study of adverse effects in people who take psychedelics outside of controlled settings, which is how 99% of people take psychedelics. And so I have some preliminary data from this study, although it's actually still running. And I want to say a little bit more about this study before I get into the adverse effects. So we were looking for people who were having a trip with one of 8 different psychedelic drugs and with only that drug. So not the people who also took other drugs during their experience. And we are mostly targeting a psychiatrically healthy population. The data today is from people who were 65% male and about 32 years old. And here up on the slide, you see the average doses of different drugs that they took. So most people in the data set today took LSD, psilocybin, or MDMA, and they took, pretty psychedelic doses of those, as you can see up here. There's also a few people who took ayahuasca or DMT who are also in the slides, but mostly it was people who took LSD, psilocybin, and MDMA. So I'm going to show you adverse effects data from all of these different studies in a moment. But first, I want to introduce you also to how we assess adverse effects, because a lot of the ways people assess adverse effects in studies are based on these kind of standard clinical scales, and they'll ask about things like headaches and nausea and very non-specific things that are somewhat relevant to psychedelics. But there's a lot of other stuff that can happen with psychedelics as well. Is it just me or someone turned the lights on in here? All right, I'm rolling with it. Anyway, so we have this systematic list of adverse effects, and we go through this list with everybody who comes to a study in person at different time points after they take the psychedelic, and it's the same scale that we use in the online study. And what I really like about this scale is it does justice to the complexity of adverse effects with psychedelics. So we go through the list and we ask people, did you have any of these symptoms? And if the answer is yes, we ask a few more questions. We first ask or try to determine whether there really was a relationship to the drug. That's quite important. If somebody who goes into psychedelic therapy feeling depressed also feels depressed after the psilocybin, it didn't necessarily have much to do with the psilocybin because they were already depressed. So in in-person studies, we determine this together with that person, and in the online study, we just ask them what they think about it. And today, I'm really only showing data from people who thought it was related to the drug. We also ask how long each side effect or adverse effect lasted, and, quite important, we ask how did you feel about it? And that's very important with psychedelics. Classic example would be ayahuasca. You may or may not know that ayahuasca tends to make people vomit. Usually vomiting is not fun. Most of us don't like it. But on ayahuasca, some people feel like it was a purge and it was worthwhile and not a negative experience. And it's important to assess this aspect of it because sometimes difficult experiences on psychedelics can feel like they're a part of a process and it actually feels like it's a good thing. In a similar vein, we also ask people, how did this experience impact your life? So it could have been an experience that was difficult or negative that had a positive impact, and if that's the case, we want to know that. And if it had a negative impact, we want to know that. And lastly, we ask them how they coped with it. All right, so let's get right into it. What adverse effects can occur with psychedelics? There's a lot of different side effects associated with these drugs. Today I'm going to focus on the ones that I think it's important to talk about. So not, headaches or minor nausea or anything like that. I'm going to focus on the more severe end of the scale. So side effects that are highly unpleasant or potentially difficult to manage, or potential causes of lasting effects after occasional intentional use of LSD, psilocybin, and MDMA in particular. And this is sort of the map of the territory where we're going to go. I'm going to talk relatively briefly about physical side effects, mainly because they're a lot easier to understand, I think, than the more psychological ones. And then we're going to talk about some more psychological types of side effects. So just to get this out of the way, the presentation feels incomplete without it, right? If we don't talk about toxicity and overdose. But with psychedelics, these are really not the main dangers. Most psychedelics are not particularly toxic. They're very well tolerated. With MDMA and also ibogaine, deadly overdose is possible, obviously not in a controlled setting, but it can happen. And with ayahuasca, there have also been some deaths recorded, most of them probably preventable if that person had gotten access to medical care more quickly. And of course, addiction with psychedelics is not even really a topic usually. I want to say a little bit more about cardiotoxicity because there's one thing that I think not a lot of people know that's starting to become a bit more of a topic. Classic psychedelics, taken occasionally, don't really cause any heart problems unless somebody might have a pre-existing condition that's quite severe. With MDMA, though, there is some evidence that regular repeated use, like more than once a month, can cause a little bit of fibrosis in the heart valves. So that's when the heart valves start to get hardened so that they don't do their job of pumping blood as well anymore. There's some evidence that this might happen in people who really use MDMA a lot. And what's really starting to come out is the potential for microdosing. That means taking small doses of LSD or psilocybin or even MDMA on a regular basis, at least a couple times a week for a long time, that this might be associated with an elevated risk of heart problems. And the reason we think that might happen is that every other drug that affects the heart similarly comes with that risk. So there are not yet any controlled studies on this, but if you do happen to be microdosing until we have more information, I would suggest you take breaks. One last thing, all of these drugs can cause certain physical symptoms, headaches, nausea, shaking. These are usually not a big problem as long as people's expectations are managed and they know what to expect. For example, LSD can often cause some shaking in the muscles. In pretty much every mammal that takes LSD, by the way, even cats and rats have some shaking somewhere. And it's usually not a problem, but it's important that people understand that it's not toxic. It usually doesn't mean they're cold. It usually doesn't mean they're anxious. It's just a physical effect. But all of these types of things can be managed also with the ayahuasca and the vomiting if people know what to expect. So usually not a big deal, and I'm going to blast through it and get to the more severe stuff. How many of you have heard the term flashbacks before in combination with psychedelics? Yeah, lots of people. It's a bit of an unfortunate term, to be honest. And it's a term that's associated with a lot of myths. But flashback, as it really is a brief recurrence of psychedelic drug effects. It may be visual. It does not have to be visual. And usually it's relatively mild. So after LSD, a typical flashback would be that people look at some trees and see them moving a little bit for a second, and that's it. It's actually quite common. It happens to about 7% of people in studies of healthy people with LSD and psilocybin, usually incredibly mild and not a problem. There is, however, a much more severe form of flashback disorder called HPPD, hallucinogen persisting perceptual disorder. Thankfully, a lot rarer than just mild flashbacks, but this is a disorder in which people repeatedly experience flashbacks over and over after taking psychedelics or also stimulant drugs. It's not just psychedelics that can cause this. HPPD can also be divided into type 2 and type 1 HPPD, whereby type 2 tends to be a lot more distressing. In type 2, sometimes visual distortions don't even ever usually go away. The person might, for example, see static over their visual field pretty much constantly. And this can come with other symptoms as well and honestly be quite debilitating. Thankfully, most flashbacks never become HPPD. But HPPD is also not a myth, unfortunately. I have here up on the slide a citation from Jules Evans, which is the head of the Challenging Experiences Project. He studies this kind of thing. And he recently did a study, which I'm going to refer back to pretty often here. He looked for people who had had difficulties after a psychedelic trip. And he interviewed them about it in an online survey and also in real interviews. And of those people, 18% said they had some kind of perceptual problems that were part of their difficulties after their challenging psychedelic trip. So it's not that uncommon amongst people who feel like they're experiencing adverse effects from psychedelics. What's also starting to come out is that, particularly for HPPD, younger people, like teenagers, early 20s, appear to be at a higher risk for it than everybody else. This was shown recently in a paper from the Robin Carhart-Harris lab, which I'll throw up on my reference list later. Also, people who used more than one drug at once were at a greater risk for it, particularly stimulants. And people who have a history of anxiety or tinnitus or visual snow might also be a little more prone to it. What's also interesting with HPPD is that most people who have it feel that they developed it after a frightening psychedelic trip, which is not necessarily all that intuitive. You know, you might think it's just a perceptual effect, but it's not necessarily. And this is kind of the core of what I want to talk about today. I'm just going to come back to this in a second. A frightening psychedelic trip is one of the biggest risk factors for adverse events on psychedelics, even for things like HPPD, which appear to be, purely perceptual. And so let me just show you the data on HPPD before I get to that. I'm kind of skipping around a bit. So in our studies of healthy people, we see also this rate of about 7% of people experiencing flashbacks, all of which are extremely mild and disappear after a couple of days. In patients, we see the same thing, always resolving a week later. In our online study, we asked people if they felt like they had an experience in which the drug effects were returning after they finished, or after they took their psychedelic drug. And I'm going to show a lot of graphs like this, so let me just explain what it looks like. Here on the x-axis, we have different drugs, LSD, psilocybin, MDMA, and then all of them together. On the y-axis, we have the percentage of people who experienced, in this case, flashbacks. And the yellow bars represent people who felt like they experienced a flashback within 24 hours after taking the drug. The orange bar is people who felt like they experienced it within 1 week. And the red bar is people who were still experiencing it 4 weeks later. And what you see here is it's actually quite common that people experience something like this. Maybe 15% or so were experiencing at least one flashback at some point. But actually with these, I also have good news. I mentioned in our studies we were asking about how people felt about these adverse effects, whether they were positive or negative, and how these adverse effects influenced them in their lives, whether that was positive or negative. And what you see with most flashbacks is people don't seem to mind them very much, at least not in this sample. So when it happens within 24 hours, most people said that it was more of a positive experience, and this remained pretty much true even 4 weeks later. So this was a sample in which people were having pretty mild flashbacks. There's no HPPD here, thankfully. It seems to be really rare. So by 4 weeks, it was having pretty much no impact on their lives anymore. So what they're telling us is, yeah, we're having some minor flashbacks, but we kind of enjoy it, and it's not a big deal. And people really emphasized this when they were writing comments, because we have a lot of open-ended questions in the survey. We really wanted to make sure that we were reflecting people's experiences accurately. And two things I want to point out here are that flashbacks don't have to be visual. They can be bodily sensations. They can also be auditory. Maybe if somebody listens to a piece of music that they heard while they were under the influence, they notice that it sounds, again, a bit like it sounded on LSD. And some people really value these kinds of experiences, or even consider them to be part of a process. So flashbacks, most of the time, are pretty mild and don't seem to bother people. HPPD is real, but rare, thankfully. Now let me come back to this common risk factor, so that frightening psychedelic trips are a risk factor for HPPD, but also for a lot of these other symptoms that I put up here. We heard a bit in the last talk about how some people had very uncomfortable trips on MDMA, and if they had not been in therapy and had that support for their process, that it might have gone very wrong. And a lot of people who were having challenging trips and struggling with them afterward, they're not in therapy. They might not have very much support, and they end up going down a pretty dark place. And so an acutely frightening psychedelic experience can really mess with someone's head for sometimes afterward. And I just want to point out, because this isn't about scaring people, most frightening psychedelic trips do not end with these symptoms lasting. A good probably 80%. I mean, a great example is Albert Hofmann. His first bicycle day, 250 microgram surprise LSD trip was very scary. He thought he was being possessed by a demon. He had to bike home. He thought he was dying. The next day, he feels great. And he sees the therapeutic potential of these substances. So most bad trips don't do this. But when it happens, when people develop distressing symptoms after a psychedelic trip, usually it was a negative one. Not always, but usually. And you might be tempted to think, well, if somebody develops these kinds of symptoms, it's probably because they had problems beforehand. They already had anxiety or they're already depressed. I would have thought so too, but what we're seeing in the most recent data is that that's actually not the case. In the study I mentioned earlier of people who had lasting difficulties from psychedelics, 2/3 of them had no psychiatric problems before they developed those lasting difficulties. So this is something that happens to healthy people. And basically the point is sometimes psychedelic trips can be so frightening, so disconcerting, that they can actually be traumatic experiences. Oftentimes there's a very clear mistake in the setting or in the way the drug was taken. That's very much often a factor. But the fact remains, sometimes these experiences, when they really go to hell, are traumatic. And I really don't mean that they dig up a past trauma the person already has. I mean that they actually can cause a new one. And when you study adverse effects, people will tell you this, and they really want this to be understood. And so it could be that these kinds of post-trip syndromes have something in common with post-traumatic stress symptoms, the most severe of which would be PTSD. And I also want to take a second here to note my terminology. I'm a researcher. I use the DSM-5. So I'm writing up here things like anxiety and depression and derealization in very clinical terms. A lot of people don't use these clinical terms to describe the experiences they're going through. If somebody may technically fulfill the criteria for an anxiety disorder after they've had a really frightening trip and are struggling with, but they might prefer to call it a dark night of the soul or an existential crisis or ontological shock is another term that I actually really like because it expresses how sometimes psychedelic trips can really make people question the structure of their minds and of reality in a way they're absolutely not ready for. So I'm using these clinical terms, but just note that these are not the only correct terms and not the only helpful terms for these kinds of experiences. So let me get into it. I'm going to talk about depression, anxiety, and derealization, especially in the context of what happens after a frightening psychedelic trip for some people. Out of the people who experienced post-trip difficulties in the study I mentioned, 12% said that they had depressive symptoms. And this is something that has also rarely been seen in clinical trials. At its worst, it can even be suicidal ideation, although I don't want to, sound an alarm about that. Most people do not develop that. But sometimes, a frightening psychedelic trip can exacerbate a problem that's already there or even throw someone into a depressive state. Pre-existing depressive symptoms may be a risk factor here. It seems to be seen a little more often in studies that involve depression, but it's also not quite clear why exactly that is. In our studies of healthy people, it's actually relatively normal to see some degree of depressive symptoms like feeling apathetic, or feeling like you're not so interested in normal activities for like the first 24 hours after a trip. It's not something we've seen within the first week after that. I think it's kind of a little bit part of the post-trip blues for some people. And in the patient sample, something similar is going on. Most people don't develop real problems with this. In our online study, it looks a little bit different, particularly with MDMA, which should surprise no one. Some people are reporting that they're experiencing some kind of depressive symptoms after the trip, but it can also happen with LSD and psilocybin and ayahuasca. And Unlike the flashback symptoms, these don't appear to be very fun for people. When we ask people how they feel about it, they say they feel rather negatively about it. When we ask how it impacted them in their life, they say it was rather a negative impact. We also ask people if they felt like they were better off dead or like hurting themselves after their psychedelic trips. In our studies of healthy people, we have not seen this at all. Thank goodness. That would be a bit of a shock. In the patient studies, actually, it did happen once. And that person had some suicidal ideation that was not there before, that may have been related to the drug, that lasted about 4 days and was worked through with integration. Thankfully, this person was in therapy. You can only imagine what it would have been like if they hadn't been in therapy. And thankfully, it's quite rare in our online sample as well, but we did have 1 or 2 people who endorsed it. And in fact, one of them even wrote us a comment about it, saying that they felt so bad physically and mentally that they thought if they killed themselves, it would stop. They experienced this as negative, no wonder, at the time. But during their reflection, they felt like this was the force needed to help them deal with their anxiety. So it was meaningful to them to choose life, which is great. I'm happy for them. I'm happy it ended well. But you see how something like this could easily, let's say, require a lot of support and go horribly wrong. This kind of thing can happen. Thankfully, this person had a trip sitter with them to help make sure they don't do anything stupid. Where depression goes, anxiety is often not far behind. So I want to talk actually quite a bit about anxiety because this is kind of a big one. As we all know, probably mild anxiety during a trip is extremely common and not usually a big deal, particularly if people are in a safe setting. That said, we mentioned frightening trips, right? Most of the time when a trip escalates to the point where it could be traumatic for somebody, fear is almost always a component of it. Fear and confusion are the 2 things that are almost always a component of that. Usually it's fear of losing control. Could also be paranoid type of fear, but anxiety escalating to absolute terror is behind a lot of these bad trips. And anxiety is actually the most common post-trip difficulty that people endorsed having in this other study. 26% of people who had any kind of lasting negative effects from psychedelics endorsed that they had anxiety as part of their symptoms. Sometimes this can include panic symptoms, and it can be related to a lot of different things. Especially during the trip itself, it's often related to something going on in the environment. You know, people are not in a good setting. They start to get nervous about something that's going on. But even after the trip, it can sometimes also be related to a fear of being judged and to a lot of different types of things that might have come up for people during the trip. And one thing that you see in the data is that if somebody's had a frightening trip, the longer that frightening portion of the trip went on, the more likely it is to cause problems. And I suspect this is because oftentimes when people experience a difficult phase in their trip, they can manage to resolve it into something positive before the drug effects wear off. And then it's over. And it maybe even is a positive learning experience. But if that doesn't happen, if it's not resolved, then of course it went on for longer and people might be at an elevated risk of developing some struggles after that experience. The setting plays a very, very important role here. So you see this type of thing way less often in safe settings. Inadequate preparation and also being relatively young are risk factors for this as well, and potentially also pre-existing anxiety conditions. In our studies of healthy people, we actually have about half the people who endorse experiencing anxiety at some point, whether mild or severe, during their LSD experience. I think this is pretty typical. Most of the time it is relatively mild. Most of the time they don't even need much help to work through it. Occasionally they do need quite a bit of help to work through it. And occasionally we have had 1 or 2 people in both the healthy people and the patients who still had a little bit of anxiety for a couple of days afterward that then resolved. In the online study, people also endorse experiencing anxiety during the trip. So during the acute phase, you see it the most often. But also sometimes afterward, people were endorsing experiencing this. It was maybe like 5% of people. Even 1 month after the trip, we're still saying, yeah, I have some anxiety, and yeah, I think it might be related to the trip. And oops. Here you see, the longer this lasts, the more people say it was a really negative experience that had a negative impact on my life. So probably in this data, you're seeing some people who are working through some things, and that's not necessarily fun, and yeah, sometimes people have anxiety, but it's worth it. But I think you're also seeing some people for whom that's suffering might be needless. And with anxiety, there's another thing I want to mention that's extremely important, is that it's not always just a drug effect. And this is another reason we talk about adverse effects, is sometimes anxiety, especially after the trip, can come from a lack of information. Maybe people have a mild flashback and they're not sure what it means. They're not sure whether that's a big deal. They're not sure whether it means they're going crazy. And if they knew that 7% of people experience that, and in 99% of cases it goes away in a week, they wouldn't be so anxious. And I want to illustrate a case of this, actually. This is from a paper by Müller and colleagues that came out last year, and it's a really good example of great publishing on adverse effects. So they published a case report of a study participant, and this is a bit of a complex case because there was also an antidepressant involved, but it's exemplary, and it's a story I've heard more than once. This person had a trip with psilocybin. They felt that they were having a flashback a couple of weeks after the trip, which is a bit late. And they catastrophically interpreted this as a sign of impending psychosis and panicked. And actually started to develop anxiety symptoms that lasted for a little while after that. And if this person had known that that flashback is probably nothing, maybe this wouldn't have happened. And this is why I really, really appreciate it when other scientists publish on adverse effects as well, because this kind of publication helps us improve our processes. And when I read this, I was like, okay, we really need to make sure people know that mild flashbacks are not a big deal. We need to drill that into people, and now I say it like 5 times before I ever get anybody LSD. Something that can also come along with anxiety, it's a bit of an odd symptom, actually. That's dissociative symptoms, derealization and depersonalization. About 15 to 16% of people who had problems after a trip endorsed experiencing derealization and depersonalization. Derealization is a feeling of detachment from the world, or a feeling that the world is seeming strange or unreal. People describe it in a lot of different ways. Some people feel like they're in a simulation. Some feel like they're in a dream. Some people have insight into the fact that this is likely just a feeling and the world probably is still real. Some people don't have that insight. And depersonalization is similar but directed at one's own self. So people can feel like they're not real, they're an imposter. And in other contexts, not to do with psychedelics, these kinds of symptoms are considered a trauma reaction. And so this is part of what makes me think that sometimes adverse effects from psychedelics come from the fact that some frightening trips can actually be traumatic experiences. In our studies of healthy people, a lot of people experience derealization of some degree during the LSD effects, and that's usually not a big deal. It's usually not frightening. People can even say that the world seems magically unreal in a way that's positive. And we had one person experience it for a day or two afterward. They weren't particularly bothered by it, but I think they were also happy once it stopped. Similar story in the patient group. And in the online studies, people are also endorsing that they experience derealization symptoms, or feeling detached from the world, or like the world seems unreal, sometimes even a month after the experience. And frankly, these numbers are a little too high for my taste, especially because people are saying it's having a slight negative impact on their lives. And when people comment on this, they'll say things like, that are frankly a little bit heartbreaking. They'll say things like, I was convinced that I was in another reality for a week after I took LSD, and it really scared my family. Anything we can do to bring that number down is a good thing, in my opinion. We see similar numbers with depersonalization, although in the online study, a lot less people endorsed experiencing that. All right, I'm coming to the end of my long list of horrible things that can go wrong after a psychedelic trip. The next category is cognitive problems, and to be honest, I'm not even sure that's the right term for them. It's a term I've taken from the Challenging Experiences Project. Let's see, 16% of people who have post-trip difficulties say that they experience some kind of problem with their thinking, and they mean a lot of different things. Some people feel like they've got brain fog, they can't think straight. Maybe they have memory or concentration problems. And some people also report feeling like they're not sure whether their thoughts are real or reliable. And this can be all sorts of things. Some people feel like they may have had a memory appear during or shortly after the psychedelic trip that they weren't sure was real. Some people might have had thoughts that made a lot of sense during the trip, but that they weren't sure they could trust afterward, and that's causing distress. And I want to highlight one case example of this just so people know that it can happen. This is from a study of psilocybin for depression that was done in London several years ago. And there was actually even a documentary about this case. So there was one patient who experienced a memory of traumatic child abuse while they were tripping on psilocybin. And it felt extremely real at the time. They felt like they were remembering the forgotten memory of how one of their parents had strangled them as an infant. And after the trip was over, though, that patient wasn't quite sure that memory was real. And in the documentary about this trial, you can actually watch him go through the process of trying to figure out whether it was real. The therapist team really does their best to try and help him, and he ends up concluding it probably wasn't a real memory, even though it felt like one. And I'm not doubting that sometimes real memories do resurface in psychedelic trips. That certainly happens. But sometimes it's just not clear. And I tend to think if people can hallucinate sights and sounds, why not memories? Why not the feeling of knowledge or insight? Maybe it feels very real and very meaningful in the moment, but a week later, you're not so sure. And it's not always possible to verify what's true and what's not. Sometimes people just have to live with the ambiguity, and that's a bit distressing. In our studies, we asked people about memory distortions, also about some of these other cognitive effects, but I'll focus on memory. A lot of people really point out that they feel like they don't remember certain chunks of their LSD experience. This is quite common, not usually too troublesome, but I think it's something people should be aware of. In the online study, people also endorsed experiencing some kind of memory distortions, and oftentimes they would write that they feel like their memory is being rewritten in some way, which is not necessarily a negative thing. It doesn't seem to be bothering them too much when it happens during the trip, but the people who were saying it's happening after the trip really didn't like it. We also asked people, going again with this theme of traumatic memories, if they feel like they've experienced upsetting memories that come to mind against their will. This actually happened once in the studies of healthy patients and or healthy participants, and in this case it was almost certainly a real memory because it was a bit expected, and thankfully it was something that person could deal with. In the patients, we actually added this question to the questionnaire after we started doing the patient data, so it's not in there. But sometimes people also say they experience this on other psychedelic drugs when they take them out in the wild, so to speak, for some reason, particularly with LSD, which I thought was interesting. And here you again also see a bit of a dissociation when it happens in the acute phase of the trip. So within the first 24 hours, people tend to think it has a positive impact, but when it starts happening later, people tend to think it has a negative impact. And who knows, maybe these are people who just don't have the support they need. All right. I'm going to end with maybe the most notorious of the psychedelic adverse effects. And this is also a bit of an umbrella term. Federico mentioned in his opening talk that people originally thought psychedelics were psychotomimetic, that they cause psychosis. And a psychosis is a similar term to delusions. Both of them involve false judgments about reality, often false judgments that that person is not aware are false. So if you hallucinate something and you know it's a hallucination, that's not a delusion. But if you don't know, then that is. And there are lots of different types of delusions people can experience. They can be paranoid delusions, where people are, for example, afraid somebody's going to try and harm them, even though that's not true. It can also be delusions of grandeur, where people think they can do anything, they're better than other people. I would also throw the term ego inflation in under this. Another example is delusions of reference, where people feel like things in the environment have something to do with them, even though that's not true. And this is a spectrum from people feeling a little bit uncertain about what's real, all the way up to a full-blown psychosis. And in this study of post-trip difficulties, a full 5% of people endorsed at least feeling like they were experiencing psychosis. They might not really have been, but at least there was some questioning of their sanity there. Risk factors, I think people who are familiar with psychedelics will have heard this before. Likely having a history of psychosis or bipolar disorder either in yourself or in a close family member is a risk factor. And you know, I'm not going to spend too much time on the full-blown psychosis because it does actually appear to be, thankfully, extremely rare, well under 1%, and usually only in people who have that in their family. What I actually wanted to emphasize was the sort of milder form of delusions, because I think a lot of people just don't know it can happen. You know, there's this idea now that psychedelics never cause real hallucinations. They only ever cause pseudo-hallucinations. So people always know when they're hallucinating. 99% of the time that's true. Occasionally it's not. And I think a lot of these actual hallucinations do sometimes go unnoticed. And let me give you an example. I was in the LSD study supervising someone who was on 100 micrograms of LSD. And she spent some time staring out the window, being pretty quiet. And she later told me, when I was staring out the window, you said something to me that was really helpful. I want to thank you for saying that. And then she told me what it was. And it was really clever, really smart, really insightful, really empathetic. Only problem was I definitely didn't say it. I really wished I had, you know, I wished I'd thought of that, but I definitely didn't say it. And it kind of threw me off for a second because I also thought psychedelics don't cause real hallucinations. Hello, what's going on here? But then it happened again a couple of months later. Again, similar situation. This time I think it was a joke, and it wasn't a very funny one, so that one I was okay with not being mine. But then I asked a couple of colleagues if they'd ever had this happen, and a couple of them said, yeah, they had. And that's kind of a benign example, right? You know, telling a joke you didn't tell. But you can imagine how it might go pretty wrong. What if she thought I'd said something awful to her, you know, and then I would have had to convince her I didn't say it. So all this just means psychedelics can sometimes cause actual hallucinations, and the setting has to be robust to that. For example, I was very happy that I had a second person in the room with me, a second trip sitter, who could have confirmed or denied something that I did or did not say. So we just have to be aware that it can happen. And as far as the full-blind psychoses, that does appear to be extremely rare. People who have it in their family maybe shouldn't roll the dice. But it's also hard to get data on prevalence on this because it's so rare. And there are some survey studies in progress that are trying to get this data, so that's coming. In our studies, we asked about paranoid delusions. So we asked people if they felt like somebody was out to get them or out to harm them. And people did occasionally say yes to that, although sometimes it seemed to have to do with the setting. In the study of healthy people, we also saw at one time having to do with the fact that we were maybe going to do experiments, even though we tell people you're not going to be forced to do experiments on LSD if it is not possible. Sometimes people occasionally have paranoid thoughts about that, and then you have to calm them down. It's honestly one of the most difficult situations to deal with psychedelics, just because as soon as somebody doesn't trust you anymore, you're pretty handicapped in your ability to help them, and sometimes you have to get a little creative about how you help them. People wrote comments about why they were feeling paranoid. One person said they felt like thoughts were being implanted in their head. That's actually a pretty typical psychotic symptom. And for one person, it was clearly having to do with the setting. They were around some strangers and they were afraid of being judged. All right. So that's my list. I don't even think I've covered all of them. But at least these are the adverse effects that seem to stand out to me as important. What seems to bother people the most are adverse effects that last for more than a week, maybe even up to 4 weeks after a trip is over, particularly anxiety, also depression and cognitive problems. And I didn't really have time to talk about this, but it's very clear that there's an interaction with the setting here. Not only the setting during the trip, but the setting after the trip. You know, if somebody's experiencing something difficult and they don't have enough support, it can pretty quickly go downhill. Which is actually also good news, because it means that if we can get support to people and get people in more supportive settings, we can bring these numbers down. Common risk factors, again, appear to be a frightening or traumatic psychedelic experience, inadequate preparation, and also younger people seem to be more prone to some of these negative effects. All right, so what now? We've been through a pretty long list of all the things that can go horribly wrong after psychedelics. What do we do about it? Those of us who work in the field as well as those who don't. And I think one thing we need to be mindful of is exactly how we communicate about adverse effects to other people. Obviously, this fear-mongering, war on drugs type of rhetoric is completely useless, right? Like, people say bad tricks are random and they cannot stop once you start them. I've heard this more than once. It's absolute BS. You can stop them once they start. But at the same time, this overly hyped rhetoric that you hear sometimes is also not helpful. You know, if people say there's no such thing as a bad trip, that's just not true. Maybe in the right setting, there's very seldomly such a thing as a bad trip. But there are definitely people out there who had bad trips that they just did not feel they got anything out of. And this is just not something you can say for everybody. If you believe it for yourself because it's useful for you, great, more power to you. But you can't generalize that to everybody else all of the time. So we need to find the middle ground. Bad trips can be stopped. And when they do happen, some of them are useful. That's very, very true. But sometimes they're not. Flashbacks have also been a source of a lot of myths and hysteria around psychedelics, and also this thing about hallucinations. And this kind of misinformation on both sides has something in common, and namely that it doesn't quite communicate the severity and prevalence of that particular effect. If I say psychedelics cause psychosis, that makes it sound like they do that a lot. You know, it might be technically true, it causes it for 1 person in 10,000 maybe, but I shouldn't say that because I'm presenting a false message, actually. After you've got somebody for whom preventative measures have failed, who's been through a really frightening psychedelic trip and is not in the majority of people who recover spontaneously, but actually feels like they're struggling with it, what do you do? This is something I wish I was able to say a little more about. For time reasons I can't, and also because the research on this is pretty young. One thing that seems important, though, is to differentiate between whether this is just a symptom that needs to go away or whether there's something to gain, even if it's hard. Because a lot of people in these studies of adverse effects emphasize that they feel like they got something out of the challenges they experienced after a trip. What you also often notice, though, is a lot of these people probably suffered a lot more than they really had to. If they had more support, more resources, they could have gotten that same gain in a less painful way. Jules Evans, the person I mentioned at the beginning who runs the Challenging Experiences Project, he also interviewed people about what they found most helpful after a challenging psychedelic experience. And people said a lot of things. One thing that's really important is this evidence-based information, which I talked about in connection to anxiety. If people know what's a big deal and what's not, and know what's likely to escalate and what's not, then sometimes these adverse effects don't exacerbate as much as they otherwise might. It's also good for people to know what to do for themselves. Social support is also something that was mentioned quite a lot, whether that's integration groups or just reaching out to friends and family, asking for help, maybe even going to therapy. And then people also mentioned different types of integration activities that were helpful. And integration is kind of a broad term that means a lot of different things, but one thing came up over and over again that seems important enough to mention, and that was that when people were experiencing especially lasting, debilitating adverse effects from psychedelics, one thing that they found most helpful was trying to find some kind of meaning in it. They had to find a reason to get better. And psychedelics in the acute phase of the trip tend to enhance people's sense of meaning. And some people reached out for that in the phase of adverse effects after a bad trip as well. And that seemed to be the road to recovery. So, in summary, what should we do now as researchers and as people who are just involved with psychedelics? In studies, I think it's still important that we really report in detail on adverse effects. There's still a lot of room to improve our knowledge of them. I showed a good example from Müller and colleagues up there. Every good, solid case report on a particular adverse effect can prevent 20 other incidents from happening, And I really notice this when I read papers and use them to improve the processes in our lab. We're also going to do this in a new study in older adults, which is a population that hasn't really been studied yet. Informed consent is also something here that should be updated as we learn more. So we really have to tell people before they participate in studies and therapy about the kinds of things that can happen. We shouldn't try to scare them more than they need to be scared. But we should make sure people are well informed so that they know as well as they can what exactly it is they're signing up for. You don't want to hear from someone a week after their LSD trip like, hey, I'm feeling really anxious, I feel like this has not been good for me, and why didn't you tell me that could happen? We have to say that. And something else that's really important in studies and in retreat centers and with patients is aftercare has to be guaranteed. And I think most people understand this. Most scientists I know understand this, but still I sometimes hear reports of studies in other places where somebody took part and felt like they were struggling afterward, and they contacted the research team, and the research team basically said, yeah, well, study's over, we can't really do much for you. We don't get to do that. We have to guarantee aftercare for people for a very long time after these kinds of trips. If we don't do it ourselves, we have to be able to refer them to somebody else, because sometimes people can start to struggle with adverse effects unexpectedly. We also need more studies of these post-trip difficulties, and I mentioned the Challenging Experiences Project. That's something you can look up if you're interested in more work on this. They do a lot, and they're a relatively new organization that's putting a lot of energy into studying this. We need to figure out how better to help people with these kinds of post-trip difficulties. And lastly, there's something that every one of us can do, whether we're a scientist or a therapist or not, and that's that we give space for all kinds of stories about adverse effects. Of course, we give space to the ones where people struggled after a trip and felt like they benefited from it, because that's a nice story, that's a good story, you're happy for them. But we also have to give space for people who experience bad trips that they felt like didn't give them anything. We don't have to be overly positive about those. And when somebody feels like they're really struggling after a trip, we have to be willing to help them and to hold space for that story as well, for all of them, because it's not about prohibition, it's about accepting these substances for everything that they can do. Speaking of social support, none of this stuff happens with just one person. I really want to thank everybody in Hasler Lab, so Professor Gregor Hasler for supporting this work and for being really willing to jump into the study of adverse effects, and also everybody on the team who helped us collect data, and all the organizations that helped us recruit, and all of our very patient study participants who answered a lot of questions from us. And of course, thank you for your attention.
That was truly excellent, Abigail. Thank you so much. That was extremely enlightening and so informative. And actually, just by presenting this data, you sort of take the fear out of the adverse events. So a really great talk, and I'm sure that we have a lot of questions from the audience. I do want to give us the opportunity. We have a break after this, so your energy levels can really get up again. But I do want to give the opportunity for some questions, about maybe 10, 15-minute questions. So same thing like before, we have 2 microphones, and please just raise your hands and a person will come to you with the microphone.
Well, first of all, thank you very much for a very informative talk. I'm just curious regarding the research, and maybe I missed it at the beginning, but I wonder if you've studied the correlation between dosage and adverse outcome. In other words, the so-called heroic dose, how much has that had an effect in terms of the adverse outcomes versus more mild doses?
Yeah, well, what we see in our data is that there seems to be a bit of a threshold. So for LSD, it appears to be about 150 micrograms, or at least what people think is 150 micrograms, above which a lot more adverse effects tend to happen. So there does seem to be a dose-response relationship. This has also been seen before in other studies from Matthias Lichty, his group in Basel. They found that after a dose of, it was either 100 or 150 micrograms, if you go up to 200, the good drug effects don't really increase, but the negative ones do. I'm not sure about heroic doses. We did ask people about the dose in the studies, and so that'll be part of the analysis, but there does seem to be some dose-response effect there.
I think over there. Okay, he does.
Thank you for the great talk. I'm wondering what you think, what's your take about the risk for induction. If I'm not mistaken, in some protocol, you see that adverse events are recorded in a very neutral way by just asking, how are you at each study visit? I know you use a more detailed scale, and I'm a bit ambivalent. I'm very curious what you think about it and what's the risk of induction versus the duty to, be more precise in the recording. So, yeah.
Right. This is a really good question. And I think it's something that a lot of people feel, right? We know that psychedelics can put people in a very suggestible state. And so we think if we talk too much about negative effects, it can become a bit of a self-fulfilling prophecy. That was basically the question, right? Yeah. And I've also felt this anxiety with the study participants, but to be honest, it doesn't appear to actually be true. I've noticed that people tend to relax more when I talk about the side effects in a neutral way, with attention given to information on prevalence and severity. So we don't just say, psychedelics cause flashbacks. We talk for a long time about what that exactly means, and about the fact that it's usually not a big deal. And of course, if these drugs were out there in a safe setting causing all sorts of negative effects for all sorts of people, we wouldn't be doing these studies. So most of the time, the information we have to give them is that most of the negative effects they'll experience will be mild. It's not really been my experience with the psychological stuff that people experience it more if you talk about it more. I think it actually reduces some of their fear of the unknown.
Okay, thanks.
Great. I think it's terrific, looking at the adverse effects and try to sort that out. But I've got kind of a political, scientific question. So, from what you know about adverse effects, do you think psychedelics should be legal?
Do I think psychedelics should be legal? Thank you, Rick Doblin, for that extremely pointed question. You mentioned political science. I'm going to answer your question, but I'm going to go to the political stuff first. Because that might be a reason someone is tempted to not really look at this stuff too hard, right? You don't want people to get the idea that psychedelics are more dangerous than they really are. And there's nothing wrong with being aware of the political implications of your work. Everything that we publish on psychedelics and adverse effects is going to be used by somebody for some reason. And being aware of that is not wrong, as long as it keeps you honest, For me, I think people who want to have the opportunity to take psychedelics in a safe and legal setting would ideally be able to do so. But it's a long road. And you do see a difference between the controlled settings and the uncontrolled settings. And I'm not going to sit up here and say that people who take psychedelics in uncontrolled settings are always putting themselves in great danger, because it's just not true. At the same time, you do see a difference in safety between those settings. And I think we're still figuring out exactly what that means. And that's why studying adverse effects, I think, will take away some of the fear of the unknown. The more concrete information we have, the more useful that can be for policymakers. And we in the psychedelic field are still a bit of a bubble. Our bubble still has to negotiate with everybody else. And so if we show people that our interest is in a genuine search for the truth and not an agenda, if we show people that, they're also going to be more likely to take us seriously and maybe consider rescheduling psychedelics someday for some purposes.
Let's take one more question. Oh, well, there are two. Okay, let's take two questions. Okay.
Thank you for your talk. So a common advice I heard during group ceremonies with mushrooms is that when somebody has a negative trip, to take more. To be clear, this was during the first hour, 1 hour and a half before tolerance kicks in. To me, that always seems kind of risky. I don't know what you think about that kind of advice.
My first reaction is bloody stupid advice. Yeah, especially when you see this dose-response risk, right? It also depends on why somebody's having a bad experience, Because there's a lot of different ways that somebody can have a bad experience. Sometimes, with mushrooms, people sometimes struggle with the somatic stuff. They're feeling really nauseous or something like that. Or it could be something psychological. I would really want to know the motivations of the person who says take more and why they think that. But to me, it doesn't seem like a good idea.
Okay, let's have one more question from the audience, please.
Regarding HPPD and flashbacks, are there neurological explanation or hypothesis? And if not, what is your personal intuition on the topic? Could it be something psychological or more something to do with the neurochemistry and topology? And also, if not, are there ongoing studies to try to figure out and understand the mechanism behind it?
Yeah, so why do people get HPPD, and are there studies about that? There are studies about that. If you're interested in that, the Perception Restoration Foundation is pushing for some work into research on HPPD. Johns Hopkins, I think, is also running an online survey study of people who have HPPD. And as far as why people get it, we don't really know. I know of two theories. One of them has to do with my other work, so I don't only study adverse effects, but we also study neuroplasticity in our lab. And especially when you see that people who are younger might be at a greater risk for HPPD, it could be that that's a maladaptive neuroplastic change that's taking place in the visual cortex or somewhere else. This is a theory. It has not been tested, but it's something that seems like it could make sense. Another theory, which was forwarded to my knowledge first by Halpern and colleagues, 2018. He interviewed a bunch of people who had HPPD, and he really noticed that most people said they developed it after a frightening trip. He thinks that it has a lot in common with PTSD, and that because these people also had a lot of other symptoms. You know, people who have really type 2 HPPD also have anxiety sometimes, derealization, maybe depressive symptoms, cognitive issues. And he saw some overlap with post-traumatic stress symptoms, and so he thought it was kind of a type of drug-induced PTSD, but we don't really know yet. That's why we got to study this stuff, you know?
Great.
If I could mention one more thing, I showed some pilot data from this online study, and it is still recruiting. It's not an easy study to recruit for, so if you're at all inclined and are planning to take psychedelics sometime in the next 3 months, you might consider giving us some information on adverse effects. Thank you in advance.
So, yeah, great. So what I think is wonderful is that even unprompted, you've been given this applause, and I think that's really excellent. What I wanted to say is I would love you guys to give a huge round of applause to Abigail Calder.